Hello, Professor. My name is Sushil, and the topic for the presentation, what I have prepared, is the data privacy issue related to the healthcare industry. So I did some research around that, and since I have been working for a while with the healthcare industry, I thought this topic is more relevant for my work. So let's get started. So the agenda for the presentation is I would like to introduce the topic of my research, then since it is related to privacy and the confidentiality, I would be walking through the point on the patient privacy and confidentiality related points. Then I would be talking on the HIPAA law, what it allows, what are the points covered by HIPAA law, and then the next one is the what is the confidentiality information we are talking about as far as the patient data is concerned. The next thing I would be talking is what research question this particular presentation is going to address, and then followed by the research methodology used, then the result, the conclusion, and the references what I have used for this presentation. I would be talking through that. So let's move on to the introduction. Typically, as far as the patient data is concerned, we have been seeing that each year the privacy of the healthcare patients is compromised for some reason, and typically these compromises are related to the data breaches between the healthcare service providers. Maybe it may be provider, it can be insurance company, it can be hospital, it can be the nurse help system what normally the healthcare services provide. And typically these breaches are mostly due to the data exchange between the healthcare providers, and with the advancement in technology, it's like there is a lot of integration between different organizations through the data standards, the EDI standards between organizations, and then there are breaches associated with that. The third point is relating to the HIPAA omnibus rule, which establishes which is actually edits onto the HIPAA confidentiality law. So it's like that is an add-on to that. And the regulatory oversight with the privacy safeguard for the business associates, typically that is what is critical. As far as the purpose of the study is concerned, it's like I have went through some of the research papers and went through some scrutiny of this topic, and what are the privacy challenges and how these breaches are. And typically I relied on one of the government sources, which is the data is available in public domain, and I have analyzed that data to get out some pivots and charts for this presentation. Next is the finding of this research. This actually establishes the positive impact of the regulatory efforts by the healthcare by the different laws that has been put in place, and it has actually helped enhance the overall situation as far as the privacy of the patient information is concerned. Moving on to the what is privacy, patient privacy and confidentiality. As the name itself suggests, it's very clear that the patient privacy and confidentiality are as good as the very basic right of the individual, and the right of the individual that their data is safeguarded through the transaction through different systems. What I mean is that different healthcare providers, because one provider cannot fulfill the healthcare requirement of one individual, it goes through different channels. So while the information or the data goes through those channels, it's necessary that is secured, and it's like there are no breaches, there are no abuses to the data. The second point is the patient needs to be comfortable in sharing the private data, and what it means by comfortable is that there has to be an assurance to the patient that the information is not being misused in some way or the other. So that aspect is also included in privacy and confidentiality. Also, the patient has all the rights to ensure that none of their privacy data is shared without the permission from the patient. It's like it's a violation. So this is what the privacy and confidentiality typically means. And if we see that I have tried to put the picture, this is again Google image, where it's like it talks about different parties involved: the nurses, the patients, the doctors, then medical center, then specialized doctors, then pharmacy. So it's like so on and so forth. And then of course the administrator, the policy administration. When I say policy, these are the healthcare policy I'm talking about. It's like it's several channels, they come together as far as the service is concerned. Moving on to the next slide, this typically talks about the HIPAA law, what it is. And actually this was enacted in 1996, and the purpose of this law was typically to ensure that with the advancement in technology, that the data is secured, and it's like it's not misused, and as the second point mentioned, it sets the standards basically as far as the privacy information is concerned, and it gives the guidelines for communication with patient, family members, and the other provider personnel related to healthcare. And it establishes the privacy data usage, like how that can be used and handled. So typically it's all about the data handling. Moving on to the next slide, what does confidential information mean to an individual? It's very obvious, however I tried to put these points together just as a talking point here. The critical information includes the name, the age, the race, the health information, what kind of health condition the person is going through, the gender, then the diagnosis history, the address, and what insurance provider you are connected with. Of course, when I have put these points, it definitely means the social security information as well, which is for sure, it's like it's part of the confidential information. So these are typical information that needs to be safeguarded as far as the patient is concerned. Moving on to the next slide, that is the research question which I am trying to address, is that how the healthcare companies are currently addressing the collection and use of personal healthcare information in their procedures. What I mean by procedure is like the exchange of information between different service providers, say for example primary health care physician to the hospital to different providers, then the pharmacy. So it's like these exchanges are like how that needs to be safeguarded in the interest of the patient's privacy information. Moving on to the next slide, the research methodology, what I have used or what I have referred through the research literature which I have gone through. It talks about, and the data source what I have leveraged heavily is the HHS data, where it's like I looked at the data which is available in public domain from 2009 to 2017, and that has been the base for the research what I have referred to. And as far as the research study design is concerned, it's like when I went through the research papers, it did mention about the different tools that has been used. Typically the time series analysis is being leveraged for this analysis, and the quantitative as well as some qualitative aspect of it. And then followed by the HIPAA omnibus rule also is part of this. Like this is an add-on to the HIPAA rule that has already been in place. And then the statistical methods is being deployed to quantify the data what was collected and then analyzed further. And typically the purpose of all this research is to ensure that the risk of the patient data being abused is answered or taken care of. Moving on to the next slide, it talks about the results. As I mentioned earlier, the source of data is HHS, that is a government data, and I have attached the spreadsheet also, which has the data points in it. When I looked at the data from 2009 to 2017, it talks about there are 551 healthcare breaches. So that doesn't mean that these many individuals are and has faced those breaches. What it means is that these are the categories of breaches basically. If we say there will be hundreds and thousands of such breaches, but these are like from the categorization point of view, there were 551 healthcare breaches, out of which as mentioned like 432 as it is showing on the right hand side also, that 432 are the healthcare provider related breaches, within which if we when I broke it down, it's like those 432 were contributed by 287 hacking instances, then which were IT incidents. Then there were 87 unauthorized access disclosure related incidents, 33 theft related incident, 15 improper disposal, and 10 loss incidents. That were the broader buckets in which they were classified, and I have put the percentage across for the total incidents from 2009 to 2017. Further ahead, there are remaining 119 incidents which were bucketed into business associates as 68, health plans related incident 49, and healthcare clearinghouse related incident 2. So these breakup was typically done in light of the HIPAA categorization, which were like as I mentioned, 551 were the total incidents, of which 432 were related to healthcare provider, 68 were related to business associate, 49 were related to healthcare plan specific, and 2 were related to healthcare clearinghouse related. So once this analysis was done and then bucketed into breaches, the conclusion what I could make out was that the results indicated that the HIPAA omnibus rule application resulted in a significant decrease in the number of incidents. Of course, I did not reflect the trend here in the previous graphs, but it's like it showed that when this was put in place, there was a significant decrease, and therefore I conclude that the HIPAA omnibus rule implementation has been successful in reducing the number of policy incident breaches. So this is what the overall conclusion I have tried to put together. As far as references are concerned, this is what I have referred to several of the research papers, and then tried to go through the information there and come out with some conclusions. Although I tried my best to put together there, it's like this is what I could pull in this time frame. Thank you. Thanks. Bye for now.